all to today's session. Myself Rajita, and here in this session we are going to discuss regarding a very common manifestation, or what we call it as a very common symptom that can be found in a client often in the clinical setup. Now here we are going to discuss regarding the condition of fever, or what we call it as hyperthermia. So generally we all know when we use the term as fever, we have a knowledge that it is basically indicating a condition where the body temperature is increased compared to the normal level of it. So here we're going to see how this body temperature is increasing, why it is occurring, and why the fever is getting developed in an individual, what are the specific types of the fever, as well as the basic treatment of it. And obviously we're going to learn here the nursing role and responsibilities to manage our client with this condition. So let's get started regarding the discussion of fever. So body temperature is basically nothing but a somatic sensation of hot or cold. Now, it is the degree of the intensity of the heat of the body in relation to the external environment. In simple term, if you are reading, the body temperature is nothing but a somatic sensation which is going to suggest whether the client is having a severe hot environment within the body or a cold temperature is present on the skin. Now, the body temperature often will be depending on the difference between the amount of heat that is produced by the bodily process and the amount of heat which is lost from the body towards the external environment. Now, this two method, if it is occurring in a balanced manner, we are going to see the client will be maintaining a normal body temperature. So definitely we are going to call the equation of body temperature as body temperature is equal to thermogenesis minus heat loss. Basically, it is suggesting the amount of heat that is produced inside the body, that is known as thermogenesis. If we are, excreting the amount of heat that is going to lost by the body surface to the external environment, if we are doing a minus from the thermogenesis, we are going to get the body temperature, which is basically suggesting the amount of heat that is present within the body surface for a particular individual. So here we're going to learn about two terminologies. The first one is core temperature. So as we have seen the body temperature, now we are going to learn about core temperature. What do you mean by core temperature? It is the temperature of the internal body tissues below the skin and subcutaneous tissue layers. Basically, this core temperature will be indicating the temperature which is present internally inside an individual's body. Now, the sites of taking this particular core temperature is often includes the rectum root or rectal root, tympanic membrane, or through the tympanic membrane also we are gonna measure the core temperature for a particular individual. In esophagus also will be showing the core temperature. Even we are going to see pulmonary artery and urinary bladder, through that also we are going to get the core temperature of the body. Basically, it is suggesting if the person is having some internal temperature, that is we are going to find under the skin or under the subcutaneous tissue layers even. Majority of the cases, the rectal usage or the rectal route while measuring the temperature or using the tympanic membrane as a method of measuring the temperature, we will be showing the presence of core temperature for a particular individual. Now we're going to learn about the surface body temperature. So it refers to the body temperature of the external surface area or to the external body tissues or to the surface. Now it will be generally measured over the skin and subcutaneous tissue layers in the body. So often we are going to see usage of surface body temperature only will be done to understand whether the person is having any chances of the development of hyperthermia or the person is suffering from hypothermia. So I hope you got the concept that in surface body temperature we are going to use the thermometers over the skin surface, maybe under the arm, or maybe in even sometimes we will be measuring it through the surface in the body. So that is how we are gonna learn about the surface body temperature. So I hope in this two temperature, about the core temperature and surface body temperature, you got the difference, what is the basic difference of it. Majority of the cases you need to remember the core body temperature always will be higher than the surface body temperature. Now we're going to learn about some control or regulations of the body temperature. Now precisely the body temperature will be regulated by physiological and behavioral mechanism in number of ways. Basically we are going to see the temperature will be controlled for an individual by different mechanism. The first one is the neural control or neural mechanism. The second one is vascular control or vascular mechanism. The third one is skin control or skin, which will be often involved into the regulation of the temperature. And then the next or the fourth one is the behavioral control. Basically in behavioral control it is suggested about the client's lifestyle. So suppose a person is wearing very heavy clothes, definitely their body temperature, even their surface temperature of the body is more likely to get increased. Now if they are using a very light clothes, they will be maintaining maybe a normal skin temperature or body surface temperature. So that is how the behavioral control is also going to be passively control the temperature of a particular individual. So as we have learned about the body temperature regulations, now you should learn about certain factors which are considered as a very common factors affecting the body temperature. It definitely includes the age of an individual, the pattern of exercise or activity they are having, hormonal level of a particular individual, the stress or anxiety if it is present for a particular individual, that also is going to affect the body temperature regulations. The next one is the circadian rhythm, and the next one is environmental area or environment. So this are the factors which will be often involving in the regulation of the body temperature. Now the environment can be internal or external environment. Sometimes you're going to see if a client is having some effect internally, maybe certain disease or digestion process when it is going on, a person is more likely to have a bit increased temperature of the body. Whereas externally, suppose a person is exposed to a very hot environment, they are more likely to develop with the increased body temperature. That is how this all factors are going to affect the regulation of the body temperature. So till here we have just discussed regarding the regulation of body temperature in a physiologic state. Now we should learn about the fever. So basically fever is an elevation of the body temperature. Now as I have mentioned in the beginning of the session, it is the most common sign and symptoms that can be found on the patient who are admitted or presented in a clinical setup to seek medical care. So basically, fever is the elevation of the body temperature that exceeds normally the daily variation and occurs in conjunction with an increase in the hypothalamic set point for 37 degrees Celsius to 39 degrees Celsius. We are often going to see this condition where the bodily temperature is increasing and exceeding the beyond level of normal regulation. A client may show some clinical manifestations also associated with the fever. And this also can indicate that the person is having some underlying pathological disease process. So here we are going to learn about certain factors which often will be causing the development of fever. The first one, exposure to extreme hot environment. Now, this acts as an external environmental factor which will be often causing increase in the core body temperature as well as the surface body temperature for our client. The next factor is excessive or intense exercise. Now here also we are going to see the person, if they are continuously doing intense exercise, they are more likely to develop a hyperthermia, or what we call it as increased body temperature. But we cannot call this condition as a development of fever, because often we're going to see once the client is stopping the excessive intense activity, the body temperature will be coming to the normal level. But there are certain factors which will be literally increasing the body temperature and will be developing the fever, which will be going to the beyond level of the hypothalamic set point for a particular individual. We're going to see the first effect can be neurogenic factors or neurogenic disorders which will be affecting or causing injury to the hypothalamus. Now, hypothalamus part of the brain will be containing the temperature regulatory activity. So where, or the temperature regulatory center. So if it is injured or affected by any disease, we are going to see the client may develop hyperthermia or fever. Most of the time, as an undesired effect for certain drugs also may lead to the development of fever for a particular individual. Usage of certain chemical substance, mainly the usage of caffeine or drug abuse, or like the usage of cocaine, also can cause an increase in the body temperature beyond the hypothalamic set point. Inflammation and infection, or a variety of infectious process, if it is present within the body, we are often going to see as a response or as a compensatory response, our body will be trying to increase the core body temperature, and we're going to see the client will be present with the symptoms of fever. Hence, majority of the infectious disease, if it is present for the client, as a clinical manifestations, we are going to see the development of fever or hyperthermia for that particular client. Same wise, if a client is having a systemic or a localized inflammation, we may see a person may develop with increased body temperature. Now, as we know, the inflammation as a part of the cardinal sign of it, there will be localized temperature increasement. Now, if the inflammation is happening in a systematic way, we can see the person can develop with fever or hyperthermia. In case of severe hemorrhage also, sometimes we will be able to see that the temperature regulatory center is failing to maintain the bodily temperature, and that is the reason a person can develop with hyperthermia. Now, as we have learned the basic causes associated with the development of fever, now we are going to learn about the types of fever. So the first type of fever is called as intermittent fever. So what do you mean by intermittent fever? Here, the temperature will be returning to an acceptable value at least once in a 24 hours. Generally, we are going to see here the temperature curve will be returning to the normal during the daytime and will be reacting or will be reaching to its peak at the time of the evening. The example of the condition is septicemia. Naturally, a client who is having septicemia, and as it is a systematic infectious condition, it is definitely going to cause the development of hyperthermia or fever. So definitely we are going to see here the client will be developed with intermittent fever, where the person will be completely subsided with the increased temperature of the body in the day, but in the afternoon or in the evening time, we're going to see the temperature will be at peak. So in this case, as once in a whole 24 hours, the client is completely subsiding with the body temperature or increased body temperature, and it is reaching to the acceptable value of it, we're going to call this condition as intermittent fever. The next type of fever is remittent fever. So here in this fever, we are going to see the fever will be reaches to its peak or height, and it will be falling, but not falling to the level of acceptable or normal range of the body temperature. So basically here we're going to see that the temperature of the body will be fluctuating. It will be reaching to a peak, then it will be falling down, but it won't be reaching to the acceptable range of the body temperature. That is the reason a frequent alteration of the body and fluctuation of the body temperature will be seen in case of remittent fever. The examples of this remittent fever associated or often will be associated with the disease condition like tuberculosis related infections, viral infections or viral fever, as well as the fever which will be almost always will be developed associated with the bacterial infection. Next, we're going to learn about the sustained fever. So here the temperature will be remaining continuously in an elevated way or in an elevated stage, where it will be going above 38 degree Celsius and will be demonstrated little fluctuation. So both in the intermittent and remittent fever we have seen there will be fluctuation, right? But here in the sustained fever we are not going to see any decrease in the body temperature. It will be at least going above 38 degrees Celsius and it will be continuously staying there until and unless a treatment is initiated for the client. Next, we are going to see the relapsing fever. Here, the periods of febrile episodes will be interpassed with the acceptable temperature of the body. So basically, the periods will be often interspersed with a high temperature or febrile period for our client. If it is happening, then we are going to call this condition as relapsing fever. Next, we are going to discuss regarding the type of fever which is named as crisis. It is a basically problem where we are going to see that it will be returned to a normal temperature from a very high temperature within a few hours or within a few days of the development of fever. So in case of crisis, we're going to see a client will be developed with a very high fever and suddenly within few hours or days, even without any treatment, the client will be reduced with the high body temperature. So even this crisis can be divided into two basic categories. The first one is known as true crisis and the second will be called as false crisis. So let us discuss now regarding the true crisis first. So in true crisis, we're going to see the temperature is going to fall suddenly within few hours of reaching to the peak. So here our client will be recovered from the high body temperature within few hours. As well as this true crisis almost always will be accompanied by a marked improvement in the client's conditions and other manifestation. So often along with the fever we are going to see the client will be complaining regarding anorexia or body pain or muscle pain, fatigue, but in case of true crisis mostly all other clinical manifestations also will be getting improved. That is the reason a client will be completely in a healthy state in case of true crisis. In case of false crisis, we're going to see although there is a sudden fall in the temperature within the body, but it will not be accompanied by an improvement of the general health for the client. So here, although the temperature is reducing, but the client will be complaining about the associative clinical manifestations that are present or that were present during the febrile episodes for the client. So that is how we're going to classify the true crisis and fall crisis depending on the sudden fall in the temperature and accompanying relief of the clinical manifestation associated with fever. Next, we're gonna call the next type of fever as lysis. So here the temperature will be often fall in a zigzag manner. So for 2-3 days, sometimes it will be increasing and decreasing. So even it can stay for a week before reaching to the normal level or normal range of the body temperature. Now during this particular episodes, even we are going to see other symptoms that are presented associated with the fever will be gradually disappear. So a client will be completely well or healthy state in this particular condition of lysis. Next, we're going to learn about rigor. So basically here we're going to see sudden severe attack of shivering will be taking place, in which the body temperature will be rising rapidly to a stage of hyperpyrexia as seen or as often will be associated with the condition of malaria. Here we are going to see basically the client will be reaching to a very high temperature, which will often term as hyperpyrexia for the client. Now, hyperpyrexia often suggests if a client is having a bodily temperature more than 40.5 degrees Celsius or 104.9 degree Fahrenheit. Same wise, we are going to classify the fever as well as the hypothermia into two categories, that is low grade fever and high grade fever depending on the body temperature. We are going to term the fever as low grade fever if it is maintaining a temperature of 37.1 degree to 38.2 degree Celsius. We are going to call the fever as high grade fever if the body temperature is maintained within 30.2 degree or 38.2 degree to 40.5 degree Celsius. So that is the basic range of low grade, high grade fever as well as hyperpyrexia. Now, as we have studied regarding the types of fever, now we should study that, or we should learn that whenever a person is present with hyperthermia or fever, the systems of the body will be getting affected. So first we are going to learn about the respiratory system and its effect of fever. So we're going to see there will be a shallow and rapid breathing often will be seen among the client who are developed with fever. The circulatory system also will be getting affected because of the hyperthermia. Often we're going to see there will be increased pulse rate and there can be presence of palpitation and increased heart rate even associated with the condition of fever. The gastrointestinal system often also will be involved. So majority of the cases we are going to see the client will be complaining about a dry mouth, a coated tongue associated with febrile episodes. Even the client will be complaining regarding anorexia or loss of appetite. Indigestion, nausea, and vomiting are very common features associated with hyperthermia. Even the client can develop constipation or diarrhea associated with the condition of fever. In case of urinary system, we're going to see often the client will be complaining about diminished urinary output. Even there can be presence of burning, micturition. And the specific gravity of the urine can actually increase here with fever. Even there will be having or presence of high yellow color or yellow coloration of the urine will be noted for the client. Now it is often occurs because of the fluid volume deficit associated with the fever in the client due to excessive amount of sweating or diaphoresis. Now, the effect also will be present of the fever in the nervous system in the body. That is the reason why a person may present with headache, Severe restlessness often will be noted in the client with fever. There can be presence of irritability even in severe cases where basically the person is present with rigor. We can see the development of convulsion for the particular client. Now, the symptoms can be associated with the musculoskeletal system even. Often we are going to see there will be present of malaise. Severe fatigue will be almost always complained by a patient who is suffering from fever. There will be presence of body pain, even joint pain. So these are the basic sign and symptoms which will be often causing on the client or seen on the client because of the effect of fever into the musculoskeletal system. Even we're going to see the integumentary system will be going under certain changes because of the effect of the fever or hyperthermia. A person may show the symptoms of diaphoresis or heavy sweating. There will be often present of hot flushes. Even the client can be present with extreme hot flushes in severe sweating in case of rigor basically. So I hope we have learned how each and every system is getting affected because of the presence of hyperthermia. Now, the common manifestations which will be present associated with the fever is definitely first increased body temperature. Even on touch, the patient body surface may seem very hot. The next one is the flushed face. So often with fever, a person will be present with a flushed face. So I hope in even in daily practice, if you look into a person who is suffering from fever or who is having a complaint of hyperthermia, their face seems a bit different. So basically, the flushed face is a very authentic and significant clinical manifestation for fever. The next is definitely hot and dry skin. So almost always a person with hyperthermia will be dehydrated. That is the reason they will be having a dry skin. The next one is anorexia. Now it is a very common complaint of a patient who is suffering from hyperthermia. There will be loss of appetite. Due to that, the client almost always will be refusing to eat, even to drink fluid. The next one is headache. So headache is a very common complaint that will be done by a patient who is suffering from hyperthermia. Nausea and vomiting, constipation and diarrhea often will be occurring among the client who are suffering from hyperthermia. Body aches are also very common. Scanty or highly colored urination is often seen among the client with hyperthermia. There will be chances of increased heart rate, even respiratory rate. There can be presence of shivering that ultimately can cause a pale and development of a cool and clammy skin for a client. Cyanotic nail bed often can be present among the client with hyperthermia. So these are the very basic clinical manifestation that would be seen among the client with fever. Now remember, this clinical manifestation also will be varying depending on the client's condition or the underlying disease process that is causing the development of the fever for a particular client. Now we are going to term or we're going to learn about certain conditions which will be directly causing the development of hyperthermia. So the first and major common condition is heat stroke. So prolonged exposure to the sun, basically to the higher environmental temperature, will be often causing this heat stroke. And in case of heat stroke, at a very initial stage, a person will be present with a severe increased body temperature. Drug-induced hyperthermia also a very common thing among the clients who are basically on some psychotropic drug or maybe who are using the selective serotonin reuptake inhibitors or serotonin related drugs. Even sometimes you're going to see a client who are present or who are having a history of a chronic and prolonged usage of certain medications will be sometimes can increase or higher the chances of the development of hyperthermia for the client. Endocrinology and related disorders also sometimes will be affecting the body temperature and its regulation. Often you're going to see the thyrotoxicity or thyrotoxicosis will be causing a increase in the body temperature for a client. Central nervous system damage through a cerebral hemorrhage or status epilepticus or hypothalamic injury often will be causing dysregulation of the thermoregulation center in the brain. That's the reason here we are going to see the client can present with hyperthermia with the cause of central nervous system damage. Definitely, as I have mentioned before, the various infections, it can be infections that is occurring in any system of the body, or maybe a systemic infection even like septicemia often will be causing the development of fever. Inflammation or severe inflammation also can develop the condition of hyperthermia. So, as we have learned regarding the etiological factors in the clinical manifestations commonly which will be present in a client associated with fever, now we should learn about the basic management of the fever. So now we are going to discuss regarding the management here with a client with fever. So initially, as we all know, first we should perform an assessment. Now this thorough assessment will include a detailed history collection and physical examination. History collection almost always will be consisting the information related to the present and past medical history, surgical history, their lifestyle as well as family history. This all related information will be helping a medical professional to identify any risk factor associated with hyperthermia or whether there is presence of any disease condition that is the main cause of the development of hyperthermia. So it basically helps a medical professional to identify the cause and initiate the treatment at earliest. The next comes the physical examination. Often, a thorough physical examination would be done for the client. A head-to-toe examination is indicated. Even the systemic examination would be performed. Now, this or through physical examination, we will be identifying the sign and symptoms that are present in a client. That will be also helping us to send or to plan the further diagnostic measure and treatment procedure for the client with hyperthermia. So soon after the history collection and physical examination, once we are getting the information that the conclusion of the diagnosis or we can conclude the condition as hyperthermia, we should perform some basic management procedure or we should follow some basic management steps. Here, monitoring of the vital signs plays a very important role for the client with hypothermia. That includes the information related to the temperature, pulse, respiration, as well as their blood pressure. Now, this monitoring of the vital signs is a very informative technique which will be suggesting a medical professional to identify any alteration related to the temperature and other vital signs. Assessing the skin color and temperature at a regular and frequent interval also helps the medical professional to understand whether the hypothermia is managed or whether the client is responsive to the administered treatment or planned treatment or whether they are unresponsiveness. So basically assessment or the information of the temperature fluctuation of the body will be also helping a medical professional to identify the type of fever that is present. It also helps the medical professional to identify, to get the information related to the responsiveness of the client towards the medical or towards the medical management that has been planned and administered for the client. Now, if the client is not responding towards the medical management, definitely the plan will be changed according to the patient need later on. So this is how we are going to collect the information from the client by performing a regular and frequent assessment of the body temperature. Definitely we are going to see blood investigations also would be suggested or the client will be almost always will be indicated to go for thorough blood studies or laboratory studies. It will be showing the presence of blood count. Often a client with fever or hyperthermia will be present with increased amount of white blood cells that is indicating that the person is present with infection. That is how we are going to assess the blood studies to identify any underlying pathological or disease process. X-ray also can be suggested for the client, because sometimes some underlying condition like the condition of endocarditis or pericarditis, which is basically affecting the layer of the heart, can lead to the development of hyperthermia. That's how all the infectious process or inflammatory process, if it is occurred inside the body, that also can lead to the development of hyperthermia. There is a reason, if it is indicated, X-ray studies would be done for the client to identify the causative reason for the development of hyperthermia. Bone marrow biopsy, liver biopsy often will be done if the client is having any other significant sign and symptoms that is indicating that the client is having any chances of the development of carcinoma. CT scan, MRI and ultrasonography would be done for a client if there is any indications of disease process progression which is related to the development of hyperthermia. Now, medical management should be definitely administered to the client with increased body temperature. Generally, we are going to see the use of acetaminophen and ibuprofen or variety of non-steroidal anti-inflammatory drugs, which will be maintaining the body temperature within the normal level. Even we are going to see the usage of indomethacin, even aspirin, glucocorticoids, corticosteroids also will be used as a steroidal drug to minimize the body temperature. So other than medical management, we will be seeing the nutritional support will be provided to the client, as the fever will be increasing the metabolic demand within the body. Fluid administration or intravenous fluid administration here plays an important role to maintain the fluid balance in the body. Often the client will be suggested to go for complete rest or to avoid excessive physical activity, as it further improve or increase the demand of the body. Tepid sponging or cold sponging would be provided to the client to manage the body temperature. Removal of excess clothing, provide hypothermic blanket often will be helping the client to maintain sufficient or the body temperature within the normal range. Administration of the antibiotic only will be suggested if there is presence or any signs of the presence of infection for the particular client. Antibiotic therapy should not be started if the fever is of unknown origin. Now, definitely, the symptoms will be recognized and further treatment will be provided if the client is not providing or not showing any response or improvement against the medical management. Now, we will be discussing about the nursing responsibilities. Definitely, nurses plays here a very important role. First, they will be providing the assessment or they will be performing the assessment to find out the symptoms and the problems within the client who are suffering from fever. So a thorough history collection and physical examination would be done by the nurse here to find out the need of the patient. Now, basic or common identifiable problem among the client who is suffering from hypothermia includes elevated body temperature. So definitely we are going to see there will be altered temperature regulations. So often the client will be present with the elevated body temperature, and even the client may have a chances of hypothermia, as there will be certain measure will be administered or medications will be administered to manage the condition of hyperthermia. So both of the cases should be focusedly treated here while providing the nursing care. The next one is nursing roles to manage this alteration of the body temperature includes providing hypothermic blanket and mattress to manage their body temperature. Removal of excess clothing play here a very important role. Well ventilation of the room should be maintained or ensured by a nurse. Next, we are going to see the room temperature will be maintained adequately. Application of the cold compress often will be suggested. Even the client may be performed or may be provided with a tepid sponging. Exposure of the body of the client to the cold substance like electric fan or some cold compression often will be helping the client to manage their body temperature. A cold bath often will be suggested to the client who are having a hyperthermia. Ice cold lavages, or even sometimes if it is not managed with medications or other measures, enemas also will be provided by the nurse to the client. Now, nutritional deficiency is the second major problem that is found on the patient. So anorexia or increased cellular metabolism, both of the factor causes nutritional deficiency. So here definitely oxygen consumption by the cells also increased in case of fever. That is the reason meeting the nutritional need of the client plays here a very important role. So that is the reason we are going to provide a easily digestible food to the client. Small and frequent diet is often suggested to the client. Avoidance of spicy food and more amount of vegetables, fluid and fruits are suggested to the client who are suffering from hyperthermia. Now, the third common problem is fluid electrolyte imbalance due to excessive sweating or increased urination. So we're going to see the fluid administration will be done if there is problem associated with oral intake. Otherwise, the client will be encouraged to increase their fluid intake up to 3000 ml. So intravenous administration of fluid also plays a very vital role here. And it is also a nurse's role to maintain the intake output chart for the client suffering from hyperthermia. Providing rest and sleep plays very important role. Providing oral care, skin care also should be done to a client who is suffering from a prolonged hyperthermia. Safety factors also should be keep on mind. So reduction of fall and injury for the client with hyperthermia should be ensured by a nurse by providing the safety devices or by using the side rails, because basically when a person is having hyperthermia or basically the rigor, they are having more chances to develop with seizure episode. That is the reason the safety of the client should be ensured by a nurse within a clinical setup. The next role is definitely monitoring the client continuously and assessment of the body temperature and other signs and symptoms at a regular interval. So I hope till here you completely got the idea related to the disease condition of or basic the sign and symptoms, which is the common symptoms associated with the underlying disease condition is fever. We have understood the concept of fever, how it is occurring, how the body regulation or temperature regulation is getting altered, and what are the types of fever also we have learned here. We have seen the clinical manifestations that are commonly going to be present among the client associated with hyperthermia. We have also seen the basic treatment, the diagnostic measures which will be used to manage the client with hyperthermia, as well as we have learned about the details of nursing role and responsibilities to treat the client with this condition. I hope you've understood and enjoyed the session. Thank you so much for attending this one. We'll meet you guys in the next session.